Right button here. Here we go. Okay, we are good to go. So as a reminder, this is the overview on the current campus prevention. So Dr. Davidson with us today is going to be talking about the recent data on the college drug and alcohol survey, talking about the historical perspectives, and then kind of where we're at and where we're looking to in the future here, really diving into those policies, prevention strategies, and recovery efforts, really through the lens of data and evaluation. So that's my brief overview here. The learning outcomes were shared, throughout the marketing for this, but he will also cover those again. For those that are on the call, I will be monitoring the chat and questions, things like that. But feel free if you need to do the raise the hand icon, you can, and we will navigate that as needed. See anything else? Other notes, I'll send out an evaluation link too. So if you do need a certificate for continuing education, your portfolio, things like that, I can get that to you. All right, David, floor is all yours.
Thank you. Glad to be here. Thanks, Annabelle, for pulling this together. And the scene behind me is on a new computer, so now I can do the virtual background. Couldn't do that before, so we can all dream about being on the coast. But thank you for doing this. I'm gonna share the screen and tell me if this works okay for you. We'll get that to a full screen, and that should be where we are. Sound good? Looks like. Okay, so the short version is we're going to look at the College Drug and Alcohol Survey. I'm going to give you some background on it, how it's changed over time. And as Annabelle shared, we're going to take a look at where we've been and where we are to help guide where we are going. And that's what's most important. If you have questions along the way, please interrupt. I want to save plenty of time at the end for discussion. So again, welcome, glad you're here. The learning outcomes that were shared ahead of time, learning some of the current and historical context, some noteworthy changes, some areas where things have gone down, some things, and that those cause me concern, some places where things have gone down that do not cause concern, some gaps, some opportunities. You'll see items that have brand new questions in 2024. That's the data that we're going to be looking at. So we can't look at trends, and some that have trends back way over in time. But it's all of this is about your opportunities as campus leaders, influencing others. You can take these data points and decide how you can use them. You can also, I'm going to share a PDF of these slides after the fact, but you can also ask if you want a certain slide or the whole slide deck as a PowerPoint. I'm happy to share that. So you can then use slide 10, 5 for your own advocacy. Here's where we're going. This is kind of how the survey has been organized. And we're going to end up with some actionable strategies. So we're going to look at things, look at some policies, prevention, support. So just a real quick piece. The data can be overwhelming, and I'm only doing highlights. I'm doing highlights here. The full data is available. I've shared the full data set it's like a 20-page summary for the 4-year schools and less than that for the 2 years because we don't have longitudinal data. The methodology was 58 questions in 2024. We added 2-year schools in 2024 separately with another different co-authors. Back in the 90s, I had some community college surveys. But this time we decided, as I partnered with the Higher Ed Center, to be more intentional and to really look at the community colleges. So we have baseline data. We're using the same questions, which I think is really important and I think is helpful. Most of the data that you're going to see is 4-year school, but then where we thought it was relevant, we didn't want to do it for every single question, but where we thought it would be particularly helpful, we put in the 2-year schools. So again, think about what you can do as what you can reasonably do and sharing this with others. And again, the whole goal with all of this tracking of where we're doing is how can we do better? How can we better provide a healthy and safe environment students as well as faculty and staff. This is just a sample of what the handouts would look like or what the raw data actually looks like. You know, it's hard to see, but it's like a 20-page document for the four-year school. And what you'll see here is each of the questions, you could see the wording of the question. You'll see the baseline year. You see this on the left side, the baseline year for whatever that question was. So we asked about beer in 1979, but the way we asked about wine wasn't until 2024. You'll see about where alcohol can be purchased and when we started that. So what we've done here is we have the current data point on the far right. We have the most recent year right next to that. We have a midpoint year, and then we have the baseline. So we're not showing the PowerPoint will show, but these tables do not show all dozen and a half implementations. That's just not needed here. And then for the two-year schools, we have it's a different format. It's the same questions, different format because there's only 1 year to share. There's only 2024. The sampling that we did in 1979 when this survey was implemented, I did it with Angelo Gadaletta, who was director of the counseling services at Radford at the time, and I was director of residence life at Radford at the time. Our basic query was, what are four-year schools doing about alcohol? So we did a sample. It was a 4-page survey. We identified 330 schools from across the nation. Our methodology was we wanted equivalent coverage in every state. So with that, you would know that Nevada and Idaho are overrepresented, and New York and California and Florida would be underrepresented because they have more schools. So we did urban, rural, large, medium, small. So literally there was no internet. We actually went to a compendium, a big, they call it the Red Book. So we went through that and identified schools. That became our sample. It is still our sample for four-year schools. A few schools have closed, so our sample is down. I think right now we're at 320, I think it's 323 schools. And then with the two-year schools, what we did is we looked at the sampling of those in our sample, and we looked at a community. Ohio State was in our sample. We looked at community colleges around there. And we ended up with 200 two-year schools as our sample. So, but our methodology was looking at community colleges near where our existing sample existed. So we're looking at similar demographics in terms of region of the country. And then we did a sample of those. So we ended up with 200. We thought that was reasonable for this first go around. We will revisit that. When Angie and I did the first survey, we had a 50%, 50% response rate. Over time, it morphed. We went up to 70%, but it morphed into online data collection, which is what we do now. We still get print versions mailed in. I'll always send a PDF of a print version. Some people still want to do it, and I must be a dozen this year. We had 120 responses. I must have hand entered a dozen that people mailed in. So we were pleased with our response rate. You'll see at the bottom here for four-year schools, it was mid-30s for that, 37%. And then for the two-year schools, it was 14.5. So we're fine with that. We're fine with that. I said earlier, we've had no external funding over time. And so that's where we are. We would look at external funding now in terms of mining the data, grad students and other specialists in terms of mining the data. So let's look at real quick scope of the problems, and then we'll look at those 5 cluster areas. One of the key questions is, how is alcohol involved with various campus behaviors? And so what this does is says if you look over time from the mid 80s, alcohol's involvement with personal behaviors has gone down. Whether it's emotional difficulty or health center, generally it's gone down. But if you just look at the far right column, the 2024, that's your point in time. So if you want a slide that just shows that, I have that available. So what you see is the red line, you're at like 47% for rape. That's alcohol's involvement with rape or alcohol's involvement with unsafe sex or health center. Similarly, you have alcohol's involvement with academic problems going down. Again, point in time, you're at 10% in terms of student attrition. Those are students who are leaving that maybe otherwise wouldn't have left. And I skipped one on, let's see. And sorry, this one, I'm sorry, it skipped over. Violent behavior, property damage, residence hall damage. Again, same pattern. All of these going down, but still alcohol has a disproportionate amount of involvement with these various campus issues, all of which we deal with. So now, what are the policies? So here's one of those points in time. Do you allow alcohol on campus? Just anywhere, anywhere, not the circumstances, but do you allow it? And that's gone up. We're at the highest point we've been in since we started the survey 45 years ago. So we're more lax. Do you require an alternative beverage when alcohol is served? Look at the big drop in 2024. This is four-year schools. Now, for your reference in the upper right corner on these, you'll see the question number. So if later you want to say, I wonder where that is, I want to see a little bit more on that, or how the question is actually worded. Is food required? That's gone down. So we think those are good things, that food is required and alternative beverage is required. What's concerning is that those requirements are getting more lax. Do you allow alcohol in your athletic venues? And we have other circumstances with those. And again, as you dive deeper into the data, you'll see that. How about accessibility? Well, server training is kind of stable. It's gone down. Do you require server training? That's the yellow line. Do you have a place where you can, or do you prohibit low-priced drinks? No longer, or less often, are we prohibiting low-price drinks? Do you have a policy on your sponsorship by the industry, whether it's at the national, state, or local level? Local brewery or state group or national. Do you have a policy? So the policies are getting more lax. So these things getting more lax cause me concern. Here's the good news. Do you have an amnesty policy? Now, here's where we put in some two-year school stuff. And you'll see that with the light gray. So you'll see a growth in amnesty or Good Samaritan policies with alcohol and with illicit drugs, just a little bit less for illicit drugs. And you'll see where the community colleges, the two-year schools are. So different. Don't want to say one is better, but this is just. And then if you have that policy, of those 92% who have the policy on the four-year schools, on alcohol, this is the four-year schools. What does it cover? So check all that apply. So less than half cover hazing of those that have it. Follows up with non-punitive, deals with cannabis. I'll note that in 2024, we're dealing more intentionally with cannabis issues. So that's a big change. So here's an example of that. What are your consequences for cannabis policy violations? And you'll see in the green line, the upper line on this one, the two-year schools. So it's a conduct or judicial sanction for over 3/4 of on both types of the campuses. Referrals for screening much more in the four-year school than the two-year. Mandatory class, probation. And again, take stock of this and say, how might this apply for us? Does it cause us some reconsideration of what we're doing? Do we want to do more or less of this item that's at 50% nationally? How about, do you have input into the licensing process? That can be at the local or state level. And again, we've added the cannabis one. You see that's we added a couple of years ago. But do you have input Do you have input just to say, hey, if you change the policy, here's the implication for our campus? Part of our thinking in adding this question, campuses can have a voice at a town council or at the state level. We did this in Virginia, I don't know, 10, 15 years ago. The governor was considering selling the state ABC stores. Virginia is a control state, so the state sells the liquor, not a drugstore, not a grocery store, not a private establishment, but the state. And so we did a statewide survey with colleges. What do you think would be the implication if the state were to divest itself of the liquor stores and those went into the private sector? What would happen with impaired driving? What would happen with property damage? What do you think would happen, et cetera, et cetera? And you can guess what the results were. The results were, oh, this would go up, this would go up, this would be problematic. For whatever reason, whether this was part of it or not, the state dropped their proposal to sell the liquor stores and to get out of the sales of alcohol business. So 18 states are control states. I'm not sure what Illinois is. So what are your consequences if you have alcohol policy violations? So again, at the 4 years, from the green line to the dark blue, on most items, conduct and judicial for some reason went down. And then you see where it is on the 2-year schools. Do you have policies? This is a new question. Do you have policies that help address the nexus? Before the webinar began, we started talking about mental health issues and mental health concerns. But how about the link between mental health and drug and alcohol misuse? So counseling and psychological services, at least at the 4-year schools, is just under 3/4. How about data collection or awareness campaigns? So again, this was a baseline for that question. It'll be interesting to see how that goes up. Hopefully it would go on not having policies. So hopefully that would be improvement over time. So that's the first one. Second area is prevention education. You see that awareness weeks are going down. That can be a good thing. Because in my earliest days, and you can see that in the days in the 1980s, that was really the claim to fame of what campuses did. And some campuses, they did was it. They did that and thought, okay, we did a week, we did a day, we did a month, we got it covered for the year. That's not a comprehensive campus program. A policy and an awareness day doesn't cover it. So this can be maturing in terms of more comprehensiveness in these various other things. Same thing with drugs. Do you have a focus period of time? Now, here's a specific new, we had a question where we asked what you were doing. We asked it differently this year to try to get at what you're covering and how you're doing it. So this is a 2-slide set, 2 slides. And this is in order by the 4-year schools. So on a 4-point scale, self-reported from none to a lot, you'll see that alcohol-specific information is at the top. Right below it, couple items below is cannabis, and couple below that is drug misuse referral and drug-specific information, whether it was cocaine or MDMA or whatever it is down at the bottom here. It's 2.3. Fentanyl, we broke out because of recent, it's just above the other drugs. So you can see where we are in prioritization on the 4-year schools. Also, 2-year schools have a slightly different array, but you see drug and alcohol misuse is second to alcohol specific, and alcohol specific is 3 out of 4. The first slide of 2 sets. And then other content areas, again, helping abstainers build community. You know, on a 4-year school, that's 2.5. Tobacco, fake pills, DEA has a lot of initiative on that. We intentionally put crash cars in there because we do not support crash cars. But we wanted to see if that was getting any traction on campuses, and it certainly gets a little. So between those two, the 4-year schools and the 2-year schools. I think uh, you can see a lot of what's covered and then what's not included. All right, two sets of slides here. In the data set, there's even more groups, but we say, to what extent do you pay special attention to the unique needs of these subpopulations for sorority, first-year students? And you see a little growth back there about a decade ago, particularly with first-year students, but pretty stable. But this is where our prioritization has been on a 4-point scale. 3.5, you're hovering with first year students, fraternity sorority, and then student athletes and women right below that. Below that is whether you have people of color or commuters and LGBTQ or disability. Those are much lower and not a whole lot of movement over 30 years. So if you look at the point in time back in 1994, we knew we were hovering around 2 on a 4-point scale. And today we're hovering around 2 on a 4-point scale. And I find that a major gap and an area of concern. How about peers? I'm a strong believer in peers. And so do you have peers and what sort of thing do they do? Well, they do health awareness, they do programs, they're on policy, high-risk activities, high-risk prevention activities. Now, again, 2 slides here. What are your channels that you use to reach students? And again, following the 4-year school priorities, 0.7% doing tabling events, followed by workshops, followed by Instagram, and so forth down the line. And you see how that's different with 2-year schools. Again, based on their population, based on their setting, based on generally the lack of residence halls, pattern about what they can do. And then look at what's at the lower level. Now, noteworthy, this is not, are you doing it? What are your top 5? So when you pick these 5, if it's educational handouts and online learning and so forth, you may not be able to get to the media campaign. You still may do it. So again, we'll relook at that. Is the top 5, should we do it a different way? But again, this is what's at the lower levels. Support services is our third area. Where do the people if the health professional is seeing them for a problem with drugs or alcohol, where they come from? Well, a quarter come from self-referral. Over a third come from judicial violation. So a message here is judicial violation is an important source of entry. It's an early intervention. It could be a mid or late intervention, actually, but it's a way to get someone into a treatment system, a assistance for issues. Do you have recovery services? And again, this is part of the great news. We have doubling of this in 9 years. So that's really good news. And then what you see is in the lower right, where you see the 34 that's our baseline for the 2-year schools. 1/3 of our 2-year schools have recovery services. Again, we'll see what that looks like in 2027. What sort of support services for students in recovery? What do you have? Individual counseling, group counseling. The light blue is your 2-year schools. So this is where we are today with support services for students in recovery. And again, on the far right, no services available. 7% of our 2-year schools. 2% of our 4-year schools don't have any services available. Now, 2% is 2 schools. Our response, our 38% response rate is 120 schools. So evaluation data collection, do you do a survey? Only drinking behavior has gone up. It'll tick up this year. But the others, some of the precursors to the drinking behavior are way down. And to me, that's a big gap. And while I'm concerned about the behavior, I'm also, if you think about a logic model, what feeds into the ultimate behavior? Attitudes, perceptions of others' use, even their knowledge. you done a formal assessment of the effectiveness of your program in the last 3 years? Less than half. And you look at the 2-year schools, 7%. 7%. Now, we first asked this question when the federal government put in the requirement for a biennial review. We did not ask the question, are you doing a biennial review as required by the federal government? What we did ask is, are you doing this assessment, which is what the biennial review asks you to do. And so we have more than half of our schools who are not honoring the biennial review. And I know that IHAC and Eric Davidson and Annabelle and others, have a big emphasis on biennial review in the training. Aside from a biennial review or any other approach, what sort of approaches are you using to measure your campus efforts? What are you doing? Do you look at goal accomplishment? Do you have a task force? 50% have a review of whatever your assessments are. Do you have a state framework, independent review? So again, different ways of measuring your campus efforts so that we can make sure that we're cost effective, that we're on track, that we're current. And then if you're doing it, again, two slides here. What is your, again, top 5? What is the focus of your measures when you're measuring the campus efforts? What is the focus? So alcohol misuse and cannabis misuse right at the very top. Illicit drug use, it's right at the midpoint. Again, two sets of slides or two different slides. So overall campus environment, just above a third. And near the bottom here, whether it's return on investment, 1%, which is one school. Program fidelity evaluation, polydrug use, a big issue. Fentanyl, again, those are not in the top 5. Or they're in the top 5 at 8% for fentanyl, for example. And then the last thematic area, and then we'll get to resources and talk about any discussion, strategic. So in the last few years, have you modified your strategies to address opiate use? Again, look at the 4-year schools. It's organized that way from 72%, just under 3/4 with student education and awareness. Professional staff education, just over half. Fake opioids, such a big initiative. And again, DEA has done so much with that. Availability of fentanyl detection test strips, treatment services. And again, you can see where the 2-year schools play out here. Now, again, here's 2 slides. When you're doing your planning, to what extent are you involving these resources? So NIAAA has the alcohol intervention matrix. Just about half of our schools, or 4-year schools, are using those, no, I said that wrong. They're at a midpoint. They're saying it's not a lot and it's not none, but 1.5 for the 2-year schools. For the CAS standards, a little lower level. How about other published practices, other compilations? That's what those were, but that could be a nice follow-on question. But then we added some new ones for 2024, so there's no point in time. How about longitudinal data? When we had others help us build the survey and say, what do you want to know? Some said, why don't you see how many people are using data from this survey? And it was called the College Alcohol Survey until 2024. So longitudinal data, Association for Recovery and Higher Education, their standards. There's 8 professional competencies. I will share that information with you momentarily. And then DEA's Prevention with Purpose. I will also share that with you. So again, those are lower levels. First time we've asked that question. We'll see how that changes over time. Does your staff receive training? And so that's gone down a little bit. And do you have a coordinator? Above 3/4. And how does the coordinator spend their time? Counseling, education, and on what topic do they spend their time? So if you go back to this one, the other drugs at the bottom, the 7%, then within that one itself, it is fentanyl is 30% of that other drug. Drug misuse in general is 26%. Do you have a strategic plan? That's gone down in 2024. That's gone down. That's of concern. Why is that going down? And then how about your funding? So we separated out in terms of overall wellness, how much do you get? And then how much of that goes for alcohol and other drugs? This is for four-year schools. So it's, you have your large schools and your small schools mixed together here. Do you have support of your chancellor or your president? In 2024, 3.7, right where it was 6 years ago and 9 years ago. And coordination and collaboration with other groups on campus. Again, you have the two-year schools added with the blue line. Greek affairs, of course, is nothing for the two-year schools, but campus police is the one, but it's gone down over recent years. Greek affairs gone down. Virtually all the collaboration has gone down. And again, this is of concern. Student government, kind of popped back up. How about assistance for faculty on alcohol and other substances? And do you have a coordinated effort at your state level? The state one is the black line. That's gone down. So IHEC is kind of standing alone. I know there's other states, but is your campus involved in a statewide effort? So there could be Illinois schools that respond and say, we're not involved. So you want to do any questions here before we go to actionable strategies, or what would you like? Just keep going and then yeah, okay. Just keep, and still sharing. Is it still showing? Yeah, it's still sharing, right? We okay with the screen? Make sure that that's still sharing okay, Annabelle?
Yeah. It
Okay,
says
good.
actionable leadership strategies.
Yeah, good. Just want to make sure because I moved myself out of it. So here's five real quick. And I've talked about three of these already. So just real quickly on each of these. So this is a book that Tom Hall, he was at University of Central Florida. He's now Orange County government, drug-free communities in Florida. And so this is a book we put together, published by NASPA. And so this has a lot of ways of thinking about your campus efforts. It's not how to do the campus efforts, it's how to think about doing your campus efforts. We organized it in this way. In the other webinar that Annabelle and I are planning is, we'll focus more on this, and it's going to focus on this strategic planning model. I know the DEA SPIF, the Strategic Prevention Framework, this is parallel to that. This is really higher ed focused. SPIF was built for communities, but it's been applied to higher ed. So there's some good resources with SPIF. I'll come back to that. But so we're going to talk about this. But again, this book has a lot of case studies and innovation and suggestions from campus personnel. Here's a resource that I had 5 others help me, from Jim Lang, who's director of the Higher Ed Center, to Joan Masters over at the Missouri Coalition and a couple of others. But we came up with a guide for the 8 professional competencies. So this is not a campus program. This is for your leadership. If you're thinking of hiring, this could help you think about what might be the competencies for some your campus program. And if you look at this, we came up with 8 competencies. I'm not going into detail here. I will in the other webinar. But what is prevention science? And we talk about that, and we say for each of these, we subdivide in prevention science or drugs and alcohol or strategic planning. In each of those, we have, again, competencies within those, and for each of those sub-competencies, we have some knowledge, we have some skills, and we have some applications. So when we think of a campus leader or someone involved with campus prevention, we think each of these 8 skill sets is important. And we think historically, people focus on the bottom if you will, the program management on the lower left and maybe policy right above it. That's mainly where they are, but they're not thinking of themselves or yourselves as campus leaders or communicating more vividly and vocally. So again, this is overwhelming. This is aspirational. But for each of these 8 areas, again, it's free. It's downloadable. It's like a 60-page document you can download, each with further resources. And there's a webinar series that I put together with each of the for each of these 8 areas with the 5 different people who were involved in the advisor. That was hosted by the DEA. Again, no federal funding, but it's hosted by the DEA. It's on their website, and I put it on the preventioncompetencies.org website, where you can go to and find it, or you can do all those fancy URLs. And then I have another website. It's on my descriptor at the end that I'm just starting to build my first website to put all of this together. My university, now that I've left 10 years, they're taking away my website. So I've got to find a place for the historical resources and just make sure things don't disappear. Prevention with Purpose. DEA came up with this maybe 4 years ago, and this is the second version. They have complementary guides that go with it. The little flower type thing with those 5 elements plus the 2 in the center is the SPIF, the Strategic Prevention Framework. Prevention with Purpose, and a lot of worksheets in there. Tom and I have a lot of worksheets on our book. This has a lot of worksheets and guides here. So the resources are here. Then you have College AIM. What College AIM does is takes a look at the professional literature and distills it and organizes things in 2 different ways. You look at the environmental and you look at individual type approaches. College AIM with individual and environmental approaches, and you're looking at things in terms of cost, you're looking at efficacy, you're looking at how easy or hard is it to implement. So they give a little checklist on that. It's not it's helpful for looking at specific elements that might go into your campus activities. Much of those strategies or those vehicles that I described in the survey. And so this is helpful in saying these are good things that have some good data behind them. That's the short version. And then last thing, put together with the higher ed center, being strategic with measurement and thinking about what you want to measure, gathering data that you can use in different ways, whether you're improving or again, accountability is important for all of us. And then some other resources. I did a book where I interviewed people who'd been involved with alcohol and drug issues from all sorts of perspectives, whether it was enforcement or treatment or recovery or legislation at the national or state level. And I interviewed them and pulled it all together and put this book together. And this is more generic. It's not college focused, but it certainly applies to colleges. So there's applications for a community, for a state, for the nation, and for campuses. But when Tom and I did the campus one, it's like, well, a lot of college people won't read this because it doesn't say college in the title or university in the title. So we did one that was really college focused. And here's a couple of other books that I've done on wellness issues and health and safety communication. So that is it. And I think now the time is to go to questions. Here are the names of the people and their email addresses for the College Drug Alcohol Survey. Again, Jim and Cindy, and Mike was a 2nd or 3rd year at Ohio State, entering his 3rd year, and interested in these issues. So I'm glad to have all of them involved. Here's my new website, my current one that's viable for the next month. And then I'm morphing it over to a new site that will have this as well as the book that I'm doing that's going to be out this fall, more inspirational reading for young adults with 365 contributions. I'm talking about juggling things. So I will stop sharing and come back to the full screen. So I know that was a lot. I know that was a lot, but I hope it was helpful. I hope it gives you some guidance. Lots to email is there. And I've sent Annabelle the two compilations of the results. I will send these slides also as a PDF. Happy to have you reach out and ask for individual PowerPoint or any clarification, or you just want to talk offline. Happy to do that. Happy to do that. So how about any questions that just come from the overwhelming 1,001 slides on a Friday? At least it's not Friday the 13th, Annabelle.
Yeah, right. Well, I was
That's
gonna share too, I've been really trying to get the resources out. So I think was it last year I went to Sean's campus and I printed off copies of like the guide to the 8 professional competencies and I've printed off, different things. We ordered copies from the DEA. So I've really been trying to be
good,
intense about getting printed things in the hands of people so then that they have it.
good.
And then providing the webinar space to talk and have these open conversations now that people have resources. So
Right, right,
hoping that'll
right.
help, with the community college space too, as I get more involved with them, realizing that things are getting a little more tailored.
Yeah, and we know that community college is, it's a whole different environment. We wanted to do some things parallel, and we have sought and will continue to seek funding to help do greater outreach. We can mine the data even further, but we think that data. One of our thoughts, and one of the thoughts we had, and again, we got different federal agencies involved last summer and fall in planning this. One of our thoughts was to convene federal agencies to talk about what, here's the lay of the land at the 2-year schools and the 4-year schools, with respect to alcohol and drugs, and whether it was NIDA or CSAP or National Institute on Alcohol Abuse and Alcoholism or DEA, who might want to come to the table and then talk about it. Now, just, with the current political environment, I don't foresee that happening in the near future, with a lot of turmoil. But as things get settled and some reorganization happens at the federal level, we have are here. Our students are thriving, and some students aren't thriving, and we have challenges surrounding drugs and alcohol, and we have good data, good longitudinal data. Some things that are the same over time, some things have gone up. Like the recovery things are going up. Wish they were going up faster, and some things are going down, and those cause concern. So I think what can we do collectively, federal officials, state officials, campus, that will be helpful in making our campuses like we did with the professional competencies. The center of that slide was health enhancing environment. That's what we want. Now your campus might be different than ours, but that's what we want. Health enhancing. And then how do we get there? Other questions or thoughts or anything?
David, I just had a question.
Sure.
Just I was trying to understand what it meant. So one of the things mentioned for recovery support was tutoring.
Yeah.
Was that referring to like academic tutoring or like some kind of personal like coaching? What?
It's what part of what you asked, let me just see if I can pull up the
Sure.
specific wording. Yeah, it was just tutoring.
Yeah.
I think it was academic tutoring,
Okay.
but that's a good query, because while we may have all, I have to go back to the actual raw question. Again,
Sure.
you will have this.
Okay.
This will all be in your hand. But let me just see how, we just said tutoring.
Yeah.
We just said, and in our thinking, tutoring meant academic, but did the respondent interpret it that way?
Sure.
So a simple thing to do for us, and if you're asking me to do this, just ask me to do this. We first asked the question at the 4-year school in 2018. We had 22%, and then 2021, 30%, now it's 26%. So we can pull in the database those 26%, which will be like 27
Sure.
schools, and say, tell us more. So
Yeah.
if we go back in time, the question on Good Samaritan,
Yeah.
way back when we said when we first did it, we just said, "Do you have this?
Hmm.
Do you have that?" And then follow on, we said, "Okay, you have it. So if yes, which of these does it cover?" And I showed you which of those it covered. So
Right.
we can whether we make that formally part of the survey or we do a private query that says, "Tell us more."
Sure.
So we can go to that 26%. I can easily go into the database. I can do it today, pull it out, say you were the 26% who said this specific question of does it mean this? Does it mean this? Does it mean this? Does it mean that? Or we can have it as an open-ended. Um, do you mean academic? Do you mean more like mentoring, tutoring? I mean,
Right.
is it like someone's like a counselor friend? We don't know. I think in our research design question, we meant academic tutoring,
Okay.
but we didn't say that.
No
So,
worries.
but if there's questions like that where you say, I would like to, at 24 point in time, dive deeper, or a suggestion for the future is
Yeah.
to reword or to further clarify.
Sure. No,
So,
I'm not.
so
Yeah, I think it was just more curiosity because
yeah,
as so for transparency,
I know nothing more.
no worries. So for transparency, I'm at Lewis and Clark Community College, and so
Good.
we just started recovery services for
Oh,
students a
wow.
few months ago. I mean, so that's
Wow.
brand new for us.
Wow.
Um, we have online counseling. We're trying to get peer support going, but it's hard to get students involved because of schedules and those kinds of
Yeah,
things. But
right.
um, yeah, I was just curious to know again, it kind of because of so much that we're trying to do. I'm just trying to get as much of this in my head in much as much detail as possible. That's all. That's all.
So no, but and that's very helpful. So part of as you're orchestrating that, and that's great that you're doing that.
Yeah.
It's like what will help me do this better,
Right.
a la more effectively for the students without too much cost. I'm not said well, but without,
Right.
how can I be cost effective, but also be most effective? Can we do online tutoring? I mean, that's a query.
Right.
That's out of my realm. I mean, more in yours. But would that be appropriate, or can we do a blend of tutoring in person, and then for every, in person, then you can do 3 online if you wanted, but then you have to come
Sure.
back and do it in person. I mean, I don't know. These become some fascinating questions,
Yeah.
but it's all about serving our students. I mean, that's where we want
Right.
help them be more effective. But thank you. That's a great question.
Thank
It's
you.
a great question. And again, afterwards, if you want to send an email or you want to follow up or talk more, happy to do that.
Sure. Thank you.
Other questions? Anything else jump out?
No, I guess the only other it was more of a comment than a question. It just
Good.
realizes for us because I'm also a mental health first aid trainer, and I think mental health first aid I can say has because of that program's talk about recovery, I think I can say, at least from that program's perspective, mental health first aid has given people a better understanding of, being better listeners and better support people and having a better understanding of the fact that recovery is a lifelong process. Yeah.
And that audience is those in recovery
That audience
or
is no, that audience is based on some Illinois standards, like we offer mental health first aid for our um advisors, for our campus safety people, for faculty members who are interested